Hi, my name is Sarah Avery, and I'm the health educator at MGH Charlestown Healthcare Center. And today we have Dr. Carolina Abuelo with us. She is an internist at Massachusetts General Hospital who completed her training in internal medicine at Beth Israel Deaconess Medical Center. She then became a clinical researcher with an interest area of HIV and human papillomavirus, HPV. She spent a year living in Peru with her family and doing community-based research on HPV. Currently, she teaches Harvard Medical School students and enjoys taking care of patients at the Charlestown Healthcare Center. And today she will be speaking with us on a message to teachers of don't fear return to the classroom. And I'll hand it over to you.
Hi, Sarah. Hi, everyone. Thank you for that introduction. I think some of you may know me from the health center. I'm glad to be here. Thank you for this opportunity. So I wrote an op-ed that was published in US News on February 23rd with that same title. And it was sort of trying to help people understand what the challenges are and how we can overcome them in terms of the risk for transmission for coronavirus in schools. And so that was sort of the beginning of all this. And maybe you could go to the next slide. And so I was hoping this presentation would kind of be helpful. I'm mostly going through how this all kind of came about. So this was sort of partly inspired by what was going on in Chicago. So like they decided in Chicago to send their kids back to school. So earlier than the Boston classrooms. But when that happened, the teachers a lot of them didn't show up, and they were clearly more afraid of getting fired. The other problems that they said that they would have would be that they were going to be cutting off their Google accounts. And the teachers really were scared, and I understood that. And I will tell you why. And you can go to the next slide, Sarah. I am afraid of the virus myself. I'm a physician. At MGH, as you know, I do a lot of outpatient medicine, but I switched to the inpatient side when we had the big surge. And I also have two kids. They're 10 and 13. So I kind of see a lot of aspects of this problem. I can tell you when this was happening last spring, I sent my family away because I was worried about getting them sick. We didn't understand how it was spread. I would come home from work and leave everything at the door, like all the clothes immediately in the laundry. I would jump in the shower and like do a serious scrub down because I didn't know if this stuff was in my hair, was on my face. I would actually try to like change at work and leave my work scrubs there and come home and clean scrubs. But even those I would leave outside. So I was definitely scared, and I lost a lot of sleep, lots of insomnia. And so just like you, my kids were out of school. And so when thinking about these problems, I see why teachers were afraid. Obviously, we told everybody to go home and shelter at home. Sarah, you can move on to the next slide. The problem, as we all know, in everything that we do in medicine, is there are risks and there are benefits. And I absolutely supported closing the schools at the beginning. We had no idea what we were in for. There was this horrible pandemic. I was caring for people who were dying. I saw this with my own eyes. And so this was no joke. And I could also see what was going on when the schools were closed. I began to understand that this was going to take a big toll on young people's mental health. It's taken a toll on adult mental health. So the kids are not okay. And this wasn't just like, oh, you're behind a year in school. Like my kids fell way behind in math, or at least a year behind. And they're struggling also. I've seen a lot of kids struggling with mental health. I'm not on the pediatric side, but I've been hearing about it. I talked to the kids' school psychologist, and she told me that what she was seeing was kids with problems already, they were getting much worse. So if they already had anxiety, they were getting much worse. If they already had like an eating disorder, it was getting out of control. And then on top of that, she was seeing new diagnoses. So she was seeing this when the parents would call and talk about what their kids were going through. And then this isn't just this year. We worry that when the kids are sort of falling behind, it actually affects their future income because of the learning losses. As I told you, my kids are like a year behind in math. Yeah. And then some people even made some, this is like statistical analysis, but they kind of projected some of these things could be like a decrease in life expectancy that would be maybe associated with this problem with education. And other studies kind of suggested that we have problems on the national level. It's not just like my kids and your kids in Charlestown. This is all over. And they were kind of projecting a loss of $14.2 trillion because of the kids being behind. So that's what happens when you close the schools. And I definitely supported at the beginning, even though those are pretty serious adverse consequences. You can go to the next slide. And so then you start thinking like, gosh, well, what's on the other side? Like, now that we understand this virus a lot more, we understand it a lot more. And we start asking ourselves like, gosh, are the schools a source of spread? Like we know that churches are, things like a wake, any place where a mask isn't being used. So are schools a source of spread? And so I started seeing or reading the data, and I don't know if you guys remember, but like Spain was hit really hard, really early. It was a horrible surge. I think very similar to ours, perhaps worse. And the studies out of Spain showed that oddly enough, they couldn't really find a lot of the transmission in the schools in Spain. And a lot of the schools in Europe closed for 8 weeks and then they reopened, and they've been open the whole time. And for instance, I have a friend whose sister lives in Spain in the region of Catalonia, where the worst part of the pandemic happened in Spain. And her kids have been in school the whole time. They go to school with their coats on all through the winter. The coats were on, the hats were on, and the windows were wide open and the doors were open. And that's what they did. They kept their schools open after that initial phase, and they just kind of kept the air circulating. In our case, our schools started here, I'm in Brookline, some of the schools started opening partly. So some of the kids went back, especially the littlest ones, they went back part-time at first. And so, of course, appropriately, they started tracking the cases. And for a long time, the only cases we had were cases in adults. And we haven't had many cases at all, but one of them was our school principal. And she got the virus from one of her kids that brought it home from college. She pretty quickly figured out what was going on. She quarantined and nobody else got it. So like, the diagnosis was made early, and the chain of transmission stopped with her. And pretty much the other cases I've been hearing about in my school are the teachers that have gotten them at family reunions, at Thanksgiving, figure it out quite quickly, get tested, isolate, and they have not transmitted it further in the schools. And then I know there was a little outbreak in Wellesley, where they were back to school earlier than we were. And out in Wellesley, there was an outbreak in the staff at the office. So these outbreaks seem to be among adults who are bringing it in from outside. They don't seem to be related to transmission inside the school. I would add that now things have changed. This week is a big week in my house because My son is now back to school full time. This is the first week, so it's day 2. And since I wrote that article in February, things have changed in my school district, and they're actually doing pooled testing, and I can explain that. So anybody who wants to participate can, but you're not obligated to. My kids are in the pooled testing. So every week they are called to do a little test in their nose. It's not the one that goes all the way back to your brain. It feels like I've had both, let me tell you. I prefer the one in the front. And this pooled testing is a pretty good way of looking at a big population. And so all of the kids' samples get put into one pool where everything's swimming around happily. They test the whole pool. It's much more efficient than testing each sample by sample by sample. Yeah. And if that whole pool comes up positive, then they can go back and individually test each sample and isolate the case. Yeah. But we've been doing this pool testing for several weeks. There have been 0 cases. So I find this pool testing reassuring. And I will point out that there are 0 cases so far, and this has been going on for a few weeks now.
A couple questions for you. First one being, why do you think that is, that there seems to be no cases going now that they've returned? What precautions have been put in place to kind of help prevent that from taking place?
Yeah, I'm glad you asked. So I think so I've been volunteering over there to be a lunch person. And I think that they're really trying hard to get the kids to go outside for lunch, which I think helps a huge amount, because that's when you take your mask off, right? Yeah. And when they do have lunch, they're seated, each child is like quite far away from the other kids. And then they're being so good. These kids, like, they'll take their mask off, take a little bite and put it right back on. They're like so on it. So I think they've got the lunches outside to the degree that they can. Obviously, yeah. There are days of pouring down rain when you can't do that. I think that I recommended that the teacher where I was, in the classroom where I was, that she keep her window open. And I think they've been doing that a lot. Yeah. And they are spacing about 3 feet apart. There's like no magic with the 6 feet apart thing. It kind of looked and could see more or less where particles settled, and this is where these numbers come from, but it's sort of, it's a little bit of mumbo jumbo. I believe in social distancing, please. Like, yes, you should social distance, but I don't know that like they absolutely have to be 6 feet apart. I think 3 feet is now what's recommended by the CDC based on the studies. So I think they also, obviously recommend that nobody goes to school with any symptoms. And so I think those are the big things. Like, everybody's got their mask on for sure. Distancing as much as they can, windows open, lunch outside. And of course, another thing that I think is making an impact is the vaccine. Our teachers were able, and I believe this is true in almost all of the state, the teachers have been getting vaccinated. I'm really happy with that. All of the vaccines that we have are wonderful because they're like between 90 and 95 or 95% effective in preventing hospitalizations and deaths. So they're phenomenal. There are some people who can still get sick, but it prevents hospitalizations and deaths. Yeah. So I think with our teachers getting vaccinated, that's amazing. I think if we can get family members to be vaccinated and staff, that would improve the potential for herd immunity. Yeah. Because as I told you, if the principal isn't bringing it in, if the teachers aren't bringing it in, then it seems quite unlikely for it to spread. I was also going to tell you one of the studies that I pulled into my article was one that like pulled in data from like 52 different studies, and they showed that children or people under the age of 20 is what they were looking at, like that. They were half as likely to get sick as adults and also much less likely to transmit. So I think, you know, it's a setting where it's much safer just because the kids are less likely to transmit and less likely to get sick.
Yeah.
I think that might have answered your question.
Yes,
Did you have another question?
Yes. So that would cover for kids, but the concern for maybe a lot of people watching this is coming from teachers of keeping themselves safe.
Good point. So I think the more that we can mask up, masks seem to prevent, it's incredible, like masks prevent like 80% of transmission. So really helpful. I think if we can get everybody to keep their mask on and to wear one that's like, you know, covers nose and mouth, not this mask, like this is not a helpful mask. This is not a helpful mask. I've seen a lot of that stuff. So like as much as we possibly can, the mask covering the nose and mouth, that is going to help prevent transmission quite a lot. If you want to the next slide, I think I talk a little bit more about this. Oh, what I just talked about. I
covered this.
All my own material. Oh, here. Okay. So the picture on the right is sort of trying to show you the distancing thing. Like, I know the schools are not easy at times to stay distant, but I think with all these different measures, using the mask, using the distancing, keeping the windows open, the risk is much lower. And I want to point out this My COVID Risk app. I tried to actually do a screenshot, but couldn't manage. This is a wonderful app from Brown University. And if you can try to remember My COVID Risk and go to that website, it's kind of fun to play with. I guess fun, as much as fun you could have in a pandemic. And it indicates like you can choose different, it's like choose your story sort of thing. And you can very simply and easily describe what you're going to do. I'm going to go to a restaurant. Is it indoors? Is it outdoors? How many people? And this app can show you what your risk is and then how to diminish it. Like you can then change stuff in the app and say like, oh, the restaurant's actually outside, not inside. And then you can see the big difference in the risk for transmission. I'm going to a funeral, nobody's wearing masks. You know? So if you go through that COVID Risk app, it is very interesting. Did you try it out, Sarah?
I haven't, but I definitely will. I think that's great.
Yeah, it's kind of fun. And it gives you a sense of things that you can do. Honestly, like, I have had some wonderful teachers as patients in Charlestown, and a lot of them have said, I really miss the kids. They've said it's heartbreaking to be on Zoom and you know somebody doesn't understand and you can't stand next to them and like try to figure out, you know, look down at their paper and figure out where the challenge is for them. So a lot of my teachers are eager to go back to school. Not everybody is, you know, I totally get it. And the remote school works for some families. It didn't work for my family. My kids like fell apart. They pretty much started whining and crying and carrying on. So I'm not saying this is a one size fits all, but I think for a lot of kids and some teachers, the in-person stuff is better, and there are pretty safe ways to go back to school. I mean, honestly, Sarah, you know my little exam room, like I don't have 6 feet of space and I can't open my window. My window's sealed shut. And I see adults. So like, I like the safest place for a lot of teachers is actually their classroom. They would have children, not adults. They could open the window, you know, they're teachers, so they can, you know, to some degree, insist that the kids wear masks. So I feel like there there are some things that are safer. This is a tough issue, and I don't want to make it sound like I have the perfect solution for every family or for every class. I don't. I was just trying to come up with things that I can do to sort of reduce risk and manage the fear. Because I know what it's like. I remember, and I am still, even though I'm vaccinated now, like I don't go and eat it. I have not eaten inside a restaurant. I have not gotten my hair cut in a salon. So, I mean, I don't like to be inside places with my mask off if I can avoid it. So I keep my mask on everywhere I go. Anyway, my point is that I can't pretend that I have every solution, but I can tell you I know how it is to be in a place where you don't feel comfortable with your risk. And at least these are things we can do.
Yeah, I have another question for you. In the beginning, you stated that when getting home afterwards, you had your family in a different place and you were trying to change everything from one office to going home, making sure you showered as soon as you got home and put your clothes in another spot. For teachers who are returning to school now, there's been a little bit more of a change in that kind of procedure that people have been doing when getting home. What would you suggest they do from transitioning from now being in a school environment to maybe being nervous when they get home to their families afterwards?
You make a good point. Like, we didn't know stuff. I sent everybody to Rhode Island where they lived with my parents for weeks, like from March onwards, they were there. I think we didn't understand. We felt like, remember, we would be like washing our shopping, I can only think of the word in Spanish, the stuff we bring back from the store. We would like,
oh yes, our produce and groceries.
Yeah. So we don't feel like that's necessary anymore. We feel like this is a respiratory virus. So I know now when I go home from clinic and like I worked again in the surge, I worked over Christmas and New Year's in the inpatient service with COVID patients. And no, I mean, I don't go home and like roll around in my scrubs and like rub my shoes in my face. No, like I still, am very careful with my masks and I wash my hands, but I'm not like freaking out and like trying to burn my scrubs. I think I understand now this is a respiratory virus. So I can avoid it by, as I mentioned, using the mask. And then I do change when I get home, but this is like a normal thing because I don't wear scrubs in the house anyway. But it's without this, like, oh my God, this stuff needs to be decontaminated in a nuclear facility. So for a teacher who's not, these teachers are not I was working with COVID patients. They're positive. I know they're sick. A teacher doesn't have that level of exposure. Nonetheless, the problem with COVID is you can transmit it without even knowing you have it. So like you want to be careful. I think it would be reasonable if you, Sarah, were, my friend and you were a teacher, I'd say, go home, wash your hands, definitely wash your hands when you go home. Your mask, take it off, leave it at the door. You don't need to touch your mask again. But I don't think you need to go into like a full on like decontamination suite and kind of jump in the shower and do like 5,000 hair washes or anything.
Yeah.
Does that help?
That does, yes.
So take your mask off, definitely wear your mask, take your mask off, wash your hands, and I think you're done.
That sounds
great. It doesn't really, I don't think it comes in on your clothes.
Yeah.
How's that?
Sounds great. That comes with a bit more reassurance than, say, a year ago.
Anything else that I can do? I don't think I have any more slides. Maybe I do.
I don't think so.
Yeah.
The last one.
I think that was it. Other questions?
The last one.
Okay.
Not at the moment, but if anyone has further questions, they're welcome to submit them either as comments, or my contact information will be there to then send along for more information. But I personally do not have any more questions for you. Any final comments that you'd like to add?
I feel like since I've written the article, we now do two things differently that make the risk even lower, and that's the pooled testing seems to be a thing in a lot of schools, maybe not every single school, but I think that adds to the reassurance. And I think now we have these amazing vaccines. So I feel like we're in much better shape. I'm grateful for our teachers for everything that they do. This has made a huge difference getting back to school. It's made a huge difference in my house. And so I want to just say thank you for teachers who teach and in the schools face to face and also virtually, because it's been a hard time for you to teach virtually too. So I'm grateful to you. And that's it.
That sounds great. Thank you very much for your time today.
All right. Bye, Sarah. Bye.